Welcome to our 3D animated journey through heart bypass surgery. Today, we'll take an in-depth look at what happens during this life-saving procedure. The heart is an essential organ, responsible for pumping blood throughout our body. However, sometimes the arteries that supply blood to the heart itself can become blocked, leading to severe complications like heart attacks. When these arteries are blocked, one effective solution is heart bypass surgery. This procedure helps restore normal blood flow to the heart muscle. Before the surgery begins, the patient is placed under general anesthesia. This ensures they are completely unconscious and pain-free during the procedure. The surgeon then makes an incision in the chest to access the heart. In some cases, the surgery can be done using minimally invasive techniques, involving smaller cuts. Next, the surgeon harvests a healthy blood vessel from another part of the body. This could be a vein from the leg, an artery from the chest, or an artery from the arm. The harvested vessel is then grafted onto the blocked coronary artery. One end of the graft is attached above the blockage, and the other end is attached below it, creating a new pathway for blood to flow. With the graft in place, blood can now bypass the blocked area, restoring normal flow to the heart muscle. Recovery from heart bypass surgery involves a hospital stay of about a week, followed by several weeks of home recovery. Patients are advised to adopt a healthy lifestyle to maintain the benefits of the surgery. Heart bypass surgery can significantly improve the quality of life for patients with severe coronary artery disease. Through advanced surgical techniques and dedicated care, patients can look forward to healthier, more active lives. Thanks for watching. If you found this video informative, please like, subscribe, and hit the notification bell for more 3D medical animations and health-related content. Have questions or suggestions for future videos? Drop a comment below. Until next time, stay healthy and informed.